I got interested in medicine, actually, I think for two major reasons. So, my uncle was a physician and actually delivered me, and he was best friends with my father, who was a pre-med advisor from a historically black college back when. So we always had a lot of healthcare discussions, always at the table. I want to be a researcher in biochemistry. And so when I went to college, my biology chair, who was the pre-med advisor, says, well, I need you to attend these pre-med meetings. So, you know, me and two other of my friends said, well, we better go to these meetings because it may make the difference between a B+ and an A- if I'm kind of humoring him. And he said, I want you to apply to this special pre-med program at Harvard Medical School. And so, of course, I forgot to fill out the application. I won't tell you that it was on purpose, but I forgot to fill out the application. So he saw me across campus just before I was leaving, and he says, hey, how did it go about filling out the application? I said, oh, I'm just so embarrassed. I let the deadline slip, and I forgot to do it. He said, you know what, I had some premonition that you might be busy, so I filled out the application for you, and would you believe it, you got accepted. Congratulations. And so I said, you know, some of these professors, they are smarter than they look. But I went to Harvard, had the best time of my life, and it was there seeing those patients that I realized that medicine was the career for me. I came to the Marion County Health Department from being primarily in the academic world. I was a research hound at Johns Hopkins. Dr. Robert Jones, Chief of Infectious Diseases at the time here at Indiana University School of Medicine, was trying to recruit me and say, hey, we'd love for you to bring your research skills here. And at that time, I was working on an NIH grant and a CDC grant. So that's how I got here. I got recruited. I first became involved in scouting because my mother was a scout leader. Okay, so I can say from a young child, honestly, I've been involved in scouting since grade school. You know, some people may say, wow, you know, maybe old-fashioned or old-fashioned because it's been around so long. But I think the beauty of scouting is that one, you develop some academic skills. I think that's important. You build a lot of self-confidence, okay? And I think it's an opportunity that we can help them with their values as it relates to any ethical and moral choices that may be in front of them, as well as a lot of leadership skills, but even just some basic survival skills in the importance of service and citizenship that they learn young, but it's a lifetime skill that stays with them for life. So I think the thing that COVID-19 has impacted me is that it has highlighted some of the glaring needs of citizens or individuals that I otherwise might not have been aware of. And I want to say especially along the lines of like social determinants. So we looked on this epidemic of how many people lost their jobs. And I realized, based on some of the recommendations that I was making, created some hardships for a number of our residents, especially when it came to our homeless population. So my health department had to go into the homeless business in order to address some of those unintended consequences from some of my recommendations. The other thing that I saw was the outpouring of the folks who came out of their communities, came out of their organizations, out of their homes to help bring needed resources to folks who didn't have it. So they went on this extra level, trying to be helpful. What can I do to help in this situation for people who did not have the needs? So how many organizations, faith-based organizations, did food pantries in order to help the folks who couldn't afford it during this downtime, okay? And so the volunteers just related to issues like that, doing so much community outreach. This is a strong city for collaboration. Let me just say this clearly. It's all about, in the final analysis, it's my staff. It's my staff. And I've got such a talented, oh my God, talented number of staff, the expertise that resides with them, their commitment. You know, we're not 8 to 5 Monday through Friday, folks. We're 24/7. And how they have just, they've just gone way above the norm in carrying out their jobs and their responsibilities. New jobs, new responsibilities is why I can say I think I've been fairly successful up to this point. So, hey, anyone, if you want to know about this, make sure you got good staff. And even better, have outstanding staff like the staff I have doing the job every day.